Hi, I'm Dr. Anna S.2.E.40, and I want to talk to you today about the emotional brain and how it really starts to rock and roll whenever you're exposed to reminders of trauma. So Daniel Goleman came up with a very interesting quote. The emotional brain responds to an event more quickly than the thinking brain. And of course, when I posted that one, that led to a lot of conversation from different individuals. And Phil asked, how does this relate to life, sports, whatever? I think that's an amazing question. Most of the work I do in practice and training is with trauma survivors or those who help trauma survivors, and this can work both for and against the individual. In emergency situations, our reaction time is super fast. That's the emotional brain giving us a chance to survive. However, if we have significant trauma memories, they can lay down a landmine of frightening memories that can get triggered in non-dangerous situations, resulting in reactions that just do not fit the situation. This can impact the way you react in every situation in life. Imagine you're going for a job interview for a job you really want, and you see the interview and he reminds you of someone who's hurt you in the past. Bang! Emotional brain ignites these old memories quickly and potentially clouds your vision of this new person you're meeting for the first time today. Your thinking brain would help you to focus on the moment and the ultimate goal of landing the job rather than being reactive. So if we were going to take the time to look a little bit more closely at what happens with the brain, that can really help you to understand all the mechanisms that can get ignited. So we're going to look at an older image developed by Time magazine a number of years ago. It is an older one, but it certainly does map it out really well. So let's go down this line and think about how helpful it is to educate yourself about what happens when you're having a landmine trigger. So you're in a job interview, and this is what's happening. You get triggered because you see that person who you feel somehow reminds you of somebody from the past, and you get this uncomfortable feeling. And right away, the brain takes this shortcut. It's a dangerous shortcut for you in this case, because what's going to happen is it's going to bypass the thinking part of your brain. So this is the shortcut. And that is the equivalent of an all-points bulletin that alerts other brain structures. The result is a classic response: sweaty palms, rapid heart rate, increased blood pressure, and a burst of adrenaline. And all of this happens before you've even had a chance to think it through. The alternative is the high road, in which you don't have an automated fear response, but instead you have the time to think through what's going on, and that actually interrupts the reaction. But you know, the brain is not going to be that easy for us to bypass, and sometimes we have to go really, really slowly and learn how to face the fear triggers before the brain will work like that automatically. So recognizing what the triggers is can be very helpful. However, what happens when you've had an automatic reaction is the body and brain are put on alert. The amygdala triggers a series of changes in the brain, chemical and hormones, and puts the entire body in reaction mode. So stress hormones are released, your heart is racing. You've got this fight or flight ignition that gets turned on to really help you get out of harm's way. Your digestion is shut down because, frankly, who needs digestion when you're running for your life? And the mind is triggering all sorts of quick reactions. So your sight and sound are really processing everything quickly to filter the incoming cues, and either sends them directly to the amygdala or to different parts of the cortex for review. Sound, sight, and smell begin to help you to identify potential threats as well. And the thalamus is the hub for sights and sounds. The thalamus breaks down incoming visual cues by size, shape, and color, and allows the brain to determine whether there's any threat or not. The cortex gives raw sights and sounds meaning, enabling the brain to become conscious of what it's seeing, hearing, and one region, the prefrontal cortex, may be vital in turning off the anxiety response once a threat has passed, or if you determined that it is not really a threat. And then the amygdala. So the amygdala sends very important messages about whether it's time to respond quickly and get out of danger. It helps you actually really survive. The bed nucleus of stria terminalis, unlike the amygdala, which sets off an immediate burst of reactions that lead to fear, the BNST perpetuates the fear response, causing a longer-term unease. And that's typically what we experience when we feel chronic anxiety. The locus ceruleus receives signals from the amygdala, and it's responsible for initiating many of the classic anxiety responses: rapid heart rate, increased blood pressure, sweating, pupil dilation, shuts down the digestion, and the hippocampus. And this is really the memory center, and it's vital to storing the raw information coming in from the senses along with the emotional baggage attached to the data. That's where we really run into trouble on our job interview, when we see our interviewer looks like somebody that reminds us of a past connection to fear or trauma. So just think this through and recognize that we are wired both to recover from difficult events as well as to remember them so that they can help us stay out of harm's way. This is Dr. Anna S.2.E.40 wishing you a gentle day.
For more Ask Dr. Anna videos and information about post-traumatic growth and recovery, subscribe and like our YouTube videos at What is PTSD, or join us at previous video episodes in our playlist Ask Dr. Anna from the Traumatology Institute team.